Cystic fibrosis by Sammy Van Houston. Cystic fibrosis has a main effect on the respiratory system. First off, oxygen goes through the mouth, through the nasal cavity, then through the pharynx, the larynx, the trachea, the bronchi, the bronchioles. Through the alveoli, oxygen goes to the capillaries, and then carbon dioxide diffuses. There are three main parts of the respiratory system. There's the airway, the lungs, and the muscles of respiration. This includes the nose, the mouth, the pharynx, the larynx, the trachea, the bronchi, the bronchioles, all in which carry air between the lungs and the body's exterior. The airways are pipes that carry oxygen-rich air to your lungs. They also carry carbon dioxide, a wasteful gas, out of your lungs. The airways include your nose and linked air passages, called the nasal cavities. As the bronchial tubes pass through the lungs, they divide into smaller air passages called the bronchioles. The bronchioles end in tiny balloon-like air sacs called the alveoli. Your blood then carries the carbon dioxide back to your lungs, where it is removed from the body when you exhale. When you breathe in or inhale, your diaphragm contracts and moves downward. This increases the space in your chest cavity into which your lungs expand. The intercostal muscles between your ribs also help enlarge the chest cavity. They contract to pull your rib cage both upward and outward when you inhale. The respiratory system works with the circulatory system. These two systems work together to circulate the blood throughout the body. The air moves in and out of the lungs through the trachea, the bronchi, and the bronchioles. The blood then moves into and out of the lungs through the pulmonary arteries and the veins that connect to the heart. Cystic fibrosis is an illness associated with the respiratory system. Cystic fibrosis is an inherited disease caused by a mutation on the gene on chromosome 7. This is one of the 23 chromosomes we get from each parent. This causes a protein called cystic fibrosis transmembrane regulator. Some main symptoms of cystic fibrosis are strong salty taste to the skin. This thick, sticky mucus blocks the lungs, causing wheezing, coughing, lung infections, and a stuffy nose. And the body can't get enough nutrients from the food, so it results in constipation, nausea, and loss of appetite. So what is the cause of this illness? It is caused by alterations in the genes that make the protein cystic fibrosis transmembrane regulator. The people that have relatives with cystic fibrosis are most likely to get it, but cystic fibrosis is not contagious. If it is possible through a genetics or blood test that someone may have cystic fibrosis, they will confirm it with a sweat test. This works by measuring the amount of salt in your sweat. For this test, the doctor triggers sweating on a small patch of skin on an arm or leg. Most likely, if you have a lot of salt in your sweat, you have the disease. So how is this disease treated? Unfortunately, there is no known cure yet, but there is chest physical therapy and vest therapy and other kinds of therapy to help loosen up the mucus. If these options are not possible, you may need surgery to move things to make it easier to breathe and reduce infections. So how exactly do you stay healthy? Well, you make sure you understand the treatment options that you may have. You can make sure to eat healthy and have a balanced diet. But not only that, but have a workout plan to stay healthy. You can take steps and precautions to avoid the illness from progressing and talk to people that have had it or ask the doctor. So some interesting information on cystic fibrosis: the life expectancy for the patients are expected to increase by 75% by 2025. Most patients don't actually get diagnosed until after puberty, and cystic refers to something characterized by cysts, whereas fibrosis is scarring in the connective tissue.